I was diagnosed with POTS back in 2002.
For 14 years, Christine Esposito has struggled with POTS, or postural orthostatic tachycardia syndrome.
The first things that started to happen for me was I started passing out. I started having a lot of chest pain, palpitations, things that were not normal to me.
Christine's symptoms progressed.
Chronic pain, GI issues, migraines, chronic fatigue syndrome.
POTS prevented Christine from participating in and enjoying life.
Postural tachycardia syndrome, or POTS, is largely a disorder of autonomic instability.
Mayo Clinic neurologist Dr. Jeremy Cutsforth-Gregory says POTS symptoms vary from person to person, but essentially all POTS patients have two symptoms in common: a rapid heart rate and dizziness when standing up from a resting position.
And they develop symptoms of insufficient blood flow to the brain.
You see, your heart pumps blood to the brain when it beats. If the brain senses that it's not getting enough blood, it triggers a sudden and dramatic increase in pulse rate and you get dizzy. A simple test called the head-up tilt or tilt-table test helps doctors diagnose POTS in minutes.
So the diagnostic criteria for POTS require an increment or increase in heart rate of at least 30 beats per minute from the supine to the standing position if a patient's 20 or older. The criteria for patients who are 12 to 19 is 40 or more.
Mayo Clinic's Dr. Philip Lowe coined the term POTS in the 1990s, but the disease has been around a lot longer than that, and so has Mayo Clinic's connection to it.
It's actually been described as far back as the Civil War, although it went by a different name then. It was called effort syndrome.
Mayo's founder, William Worrell Mayo, examined young men enlisted to fight in the Civil War. Some complained of fainting and dizziness. The thought was that these troops were too scared or lazy to fight, and their dizziness was a sign of weakness. Experts say they likely had POTS. Today, patients like Christine are relieved when a diagnosis confirms that their symptoms are real. And while there's no cure, there are ways to manage POTS. Medication may help, but the keys to feeling better include
fluid, salt, compression, and exercise.
Salt allows your body to hold on to fluid inside blood vessels, which can help keep blood from pooling in the legs and abdomen. Compression also bolsters blood flow, and exercise benefits overall health.
My dog's name is Zoe. She is a perfect fit for me.
Christine participated in Mayo's POTS Boot Camp. It's a program that helps patients learn how to manage symptoms.
They teach you how from everything from posture to exercise to eating.
There is no cure for POTS, which affects young people and adults.
On days that I don't feel well, Zoe will lay by me, she'll rest with me, she'll get up, she'll walk to the bathroom with me. On days that I feel great, we're outside, we're in the yard.
But by managing symptoms, people like Christine can get back to life. For the Mayo Clinic News Network, I'm Vivien Williams.